Hi, everyone. Welcome to this interview. For ELPA, it's an honor to have Dr. Marta Ramón Krauel, Paediatric endocrinologist, head of endocrinology department in Hospital Sant Joan de Déu Children's Hospital in Barcelona. She is expert in obesity, diabetes, growth, and poverty. Thank you to be here. We are concerned about the increase in childhood obesity in the metropolitan area of Barcelona, in Catalonia, and in the Mediterranean countries. It is going to get worse or much worse, doctor?
Well, hello, everyone. It's a pleasure to be here and speaking about obesity because we are really concerned. So obesity in children and adolescents has increased in most countries, as you know, in recent years. And Spain, as you were saying, in other Mediterranean countries such as Greece and Italy, actually they have the highest prevalence of childhood obesity in Europe. So many countries have implemented a diversity of policies trying to reduce such numbers. And they've done lots of actions, from actions at school, like supervising menus, limiting vending machines, doing nutritional education and physical activities, actions at the level of the community, such, in having more green areas, sport facilities. Obviously, there's also a big investment in the healthcare system. And with all these actions before COVID, actually some countries have seen stabilization of the numbers, and even some have seen a slight decrease. However, then COVID came and this has dramatically changed again. And despite some countries has achieved this plateau at some point, it was only in certain countries and sometimes in certain areas, and there's a lot more to do. And as a general thing, it's still growing. So we are really concerned.
So it is a disease marked by family income levels?
So obesity is seen in rich and poor countries and among different socioeconomic levels, so it affects everyone. But it's true that low-income families and low parental education is associated with a higher risk for childhood obesity. There's many studies and reports, and I will mention the European World Health Organization COSI initiative that showed that parental education was, for all the determinants, for most countries, one of the most important aggravating factors. And with the policies that I mentioned earlier that also have been implemented in school, in Spain, a lot of these policies have been made try to fight obesity. We observe that overweight and obesity has decreased in higher social economic levels, and it has dramatically still increasing in low income and low parental education families. So the gap between socioeconomic and education levels has actually increased.
Yes, thank you. So is childhood obesity perceived enough as a disease?
Unfortunately, no. So many studies have shown an underestimation of overweight and obesity status by the parents. So 40 to 60% of the parents tend to minimize their children's weight. And furthermore, even if they perceive that they might have overweight and obesity, obesity per se is not perceived as a disease by the society many times. And this is something that we need to work on, because it's very important. If people do not perceive that they have a problem or their child has a problem, it's very difficult that they actually take some actions to try to improve that situation. So that's something we really need to work on.
Yes, and do children with increasingly younger obesity arrive at your hospital in Sant Joan de Déu in Barcelona?
Yes, in the last few years, we are seeing more and more children with marked or severe obesity starting before the age of 5. I would say a decade or two ago, that would be very, very rare to see in our visits. And obviously, children who start at such a younger age, they probably have a genetic predisposition, but the genetics of all of us haven't changed that dramatically. And however, there's a lot of changes now on lifestyle and feeding practices and screen time, and definitely I'm concerned about this rise of obesity in very, very young children.
Yes, but what experts tell us every time that obesity leads to diabetes, hypertension, greater possibility of cancer, greater possibility of heart attack and other complications. All this does not scare families.
So families who understand the health-related problems that occur with obesity are indeed scared and they want to do something about it. However, as I mentioned earlier, not all the families perceive their child as being overweight or obese, or even if they are obese, they don't perceive it as a disease, or they don't understand, or there's definitely some barriers about how we can communicate with families. And we need to work on this, and the families need to be aware of the health consequences of obesity. I will say that a lot of families, they do understand that, and they actually are scared and they want to implement changes. However, it's not always that easy.
It's difficult. Greece, Italy, and Spain have the worst figures for childhood obesity in Europe. Therefore, if obesity begins earlier, the complications derived will also arrive before.
So the Mediterranean countries, as I said earlier, have the worst figures in childhood obesity in Europe. I will say for every country that applies, the earlier you start, you might think, no, the earlier you have obesity, the more complications we're going to have. And that's definitely a concern. However, we need further studies, follow-up of these children to understand the health implications of obesity at such a younger age, because that's a new phenomenon. We don't have many data on adults who started obesity when they were younger than 5.
In Catalonia, one out of 4 children under 12 years of age is overweight, and 1 out of 10 has obesity. Does this bring us closer to United States levels?
Unfortunately, as our figure rise, yes, we get closer to the US figures. But I want to mention that in the States, it's also true that the distribution of obesity, it's not equally distributed among states or even within the same state in different regions or areas. And as I said, socioeconomical and educational status is very important. That also happens here in Catalonia. So yes, numbers are rising, but we need to understand why, where, and try to implement new policies that actually help.
Yeah, thank you. What worries you most, however? The lack of adherence to the Mediterranean diet or the increasing use of children's computer screens?
Well, that's a tricky question because obesity is a multifactorial disease, and we should, in order to improve it, we should improve all aspects of it that could lead to obesity, and also like every individual might have more impact of one of these two that you're mentioning. Some kids have a lot of screen time, and other kids it's more problem the diet that they have, and usually they go together. But I'm also worried about probably more about screen time because of the implications. Behaviors have an implication not only on obesity, but also on development of as an individual. And I think that probably screen time has a big impact on a lot of other aspects.
Yes. The family structure has also changed. Maybe we have changed grandparents to screens.
Yeah. So life, we're talking about life for parents and even single parents in developed societies. It's difficult when working and usually and not having much family support. The family structure, as we said, has changed. We usually live all together as before, and they might live far away, or even grandparents might still be working. And screen can be used often as a saver. No, if I'm coming from work, I pick up the kids at school, and I need to do dinner, the house, and everything. So, and nobody else is there to take them outside and play. So probably I need to use the screen. So I don't know if it substitutes the grandparents. Hopefully not, but it definitely has an impact.
Yes, yes. But if the theory is so easy, what we all know we need to eat healthy and move a lot. Why don't we follow it?
Well, as you said, the theory is very
The
easy, but
question.
implementing is not that easy at all. And even think about, I don't know you, but I put myself as an example. I am a person dedicated to childhood obesity, so hopefully I do have knowledge to know what's going on. I have a high education level. I have a pretty stable life and not too many worrisomes. And even like this, sometimes if I'm hungry, am I weak when I'm hungry and I want to eat more? Am I lazy sometimes to go to the gym? So imagine trying to implement that when you have not much family support, economical worrisomes, your priorities might be different, your resources, and even your abilities to talk to your children or make them do what you want to do. So all this makes it very difficult.
Yes, I agree. From obese parents to a son with obesity, does this work that way?
So generally, I will say that will be the case that will be the way in most cases. So obesity has a strong genetic component, and also in the same family, we will have the same genetics, but also the same environment. And that puts you at a huge risk. And also children, they learn their habits from imitation. So whatever they learn in that household, it's probably what they're going to do even when they move away from the house, because that's, we learn by imitation.
Yes, thank you to clarify. At Sant Joan de Déu in Barcelona Children's Hospital, since 2016, you are trying to fight obesity with motivation program. What does that mean?
So taking into account all the things that we said earlier, that how difficult it is to change habits, and also knowing that most of obesity programs have a very low success rate. What we've done is try to look in the literature, every piece of information that we could, that programs that or aspects of the program that might lead to success. And so basically, that's what we, in trying to implement. It's a holistic program that takes into account the person, the family, and all the things that might lead to, obesity, and how is the structure of that family, and other environmental factors that might be important. Also, it's targeting the family and using motivation. It's important to motivate. It's important not to make them feel guilty. And all this approach with very practical scenarios, multidisciplinary approach. We have nutritionists, but also we have nurses. We have a specialized in physical activity and social worker.
Different things. This is a program.
Sorry?
Does eating comfort us?
So comforting, so yes, we not always eat because we're hungry. So that's part of what we do in the program. We actually teach children and families to recognize when they have desire to eat. Think about if they are really hungry, or they simply want to eat because they are bored, or because they are seeking comfort. Because really, when we feel sad, that could be a way of seeking comfort.
Do soft drinks refresh or make you fat?
So
soft drinks.
So sugary drinks definitely are linked to obesity, and I would say usually, as I said, obesity is such multifactorial, and even dietary patterns are multifactorial. But there's been studies just linking sugary drinks with obesity, and that's a pretty strong link. So I will say drink water. Definitely, there is also sugar-free drinks, but sugar-free drinks, they also have this sweet taste that might lead us to want more sugar. So definitely, I will say these will be for special occasions, and usually drink water.
But sugar is a drug for our bodies?
So sugar stimulates receptors in our brain that makes us feel well, and that has a positive reinforcement that generally leads us to want more. This is I would say we probably cannot consider a drug, but some of the mechanisms for addiction are similar. So I was saying that this positive reinforcement of making feel good, it occurs with sugar, but also with artificial sweeteners that can have the same effect, even if they don't have caloric. They don't have calories that they lead to this mechanism.
We are finishing. What about stigma? What would be your advice in order to fight against stigma related to obesity, in particular in children?
Yeah, that's important because a lot of children that live with obesity, they suffer from bullying or other discrimination at school, and that's very hard because that definitely doesn't make you feel good, and it's probably even harder for you to implement changes because you don't feel strong. So definitely we need to fight against stigmata for any disease, and obesity. It's always been a lot of stigmata, and I think people believe that that's your fault because you eat more and they don't take into account considerations such as your genetics or your difficulties at home or other things. So I definitely think that we don't need to make feel anybody guilty, and that we should all try to fight against obesity, trying to do our best.
Yes, perhaps with more information, more conversations.
Yes, information
for children. Don't be afraid, I think.
Yes.
So we are arriving at the end. And please, if you have some comments, adding some ideas for this.
So I will say that the most important thing will be to do prevention, because treating obesity, it's very hard. So definitely prevention. So we try to implement healthy eating habits at school, at home, in societies, positive messages, never like negative message, you cannot do this, you cannot, no, just try to do a healthy lifestyle for all of us, and probably as a society will be much better. Thank you for having me.
Sure. Thank you very much. All in all, thank you for your support and involvement in children and families' health. Thank you very much, Doctor.
Thank you.